Hi everyone, welcome back. If you are new to my channel, please consider subscribing. My name is Yadi, and in today's video, I am going to talk to you guys about how to use a cavitation machine for body contouring. Now, just a quick disclaimer, please be sure to seek proper training certification for more information. Look for your state's regulations and proper licensing regarding the body contouring business. Do your research thoroughly. Now, if you find this video helpful, don't forget to share, like, and I hope you enjoy. All right, let's get started. What is it? Ultrasound cavitation is the use of ultrasound technology to break down fat cells below the skin. It is a non-surgical method of reducing cellulite and localized fat. Cavitation machines come in 30K, 40K, and 80K. But what do these numbers mean? They basically refer to how strong the machine operates by cycles per second, meaning 40K operates in 40,000 cycles per second, treating your fat cells at that rhythm. The client does experience an inner ringing in the ear. A cavitation device uses ultrasound and RF, also known as radiofrequency technology, to break down fat cells in your body. Basically, heat and sound waves are used. They penetrate your skin and then break down the stubborn fat, convert it into small pieces, and then convert it into a liquid substance that then leaves your body mainly through your lymphatic system or your urinary tract. How does vacuum RF therapy work? The vacuum radiofrequency therapy system uses suction and pressure to release the fluids in the fat cells that cause cellulite, along with radiofrequency energies to create superficial and deep heating of connective tissue fibers, dermal collagen, fibers, and fat cells. These energies soften the connective tissue and stimulate the production of new collagen for improved skin elasticity and resilience. Vacuum RF therapy can be done over the entire body, although the most common areas are legs, buttocks, abdomen, and upper arms. How does radiofrequency body contouring work? Radiofrequency body contouring heats the skin to over 104 degrees, in which safely and comfortably minimizes the appearance of cellulite dimpling and fatty bulges, while tightening the skin and improving the contour of the targeted area. At the deepest level, the RF alters the network of connective tissues that hold the fat cells in place, pulling them closer together so that the cellulite does not bulge out and create the well-known rippling we associate with cellulite. RF, which is radiofrequency, also targets the fat cells themselves, causing them to shrink in size, which has the effect of slimming down the targeted area. Where in the body can treatment be done? Well, the abdomen, waist, back, thighs, hips, the upper arms. This procedure cannot be performed on body parts like the head, neck, chest, or breast area, and other bony areas of the body. The main benefits of ultrasound cavitation are body shaping and contouring, skin tightening and toning, and cellulite reduction. When will I see results? The ultrasound cavitation treatment will often give immediate results, which you can feel, touch, and see, and it can be long-lasting. Some clients can experience between 1 to 4 centimeters of circumference reduction after one single session, with increasing results after more visits. Multiple sessions are usually required, generally one per week, until you've had about 4 to 10 treatments or more in total. This will depend on the results you want. Can I lose weight with ultrasound cavitation? Ultrasound cavitation is not a treatment for obesity, nor is it a weight loss procedure. It is a method for reshaping and toning the body. It is intended to reduce localized fat tissue around the abdomen, waist, buttocks, and thighs, and other areas. Now let's talk about some contraindications. Pregnancy, breastfeeding, transmissible diseases, heart disease, cancer, undergoing chemotherapy or immune therapy, epilepsy, lupus or an autoimmune disease, high blood pressure, diabetes, uncontrolled, keloid scarring, excessive pigmentation, vein inflammation, prednisone and other steroid medication, chemical peels and laser resurfacing, sunburn, recent surgeries. So if you've had a recent surgery, you must wait a minimum of 3 months. Now let's discuss some before and after care. You must drink at least 2 liters of water before your treatment and another 2 liters per day following your treatment. Avoid alcohol consumption for 2 to 3 days following your treatment. Remember, alcohol can prevent your liver from working to remove the fat, as it will make alcohol metabolism its priority before the fat removal, and it could hurt your results. Try to avoid caffeine for at least 1 to 2 days prior to your appointment and 48 hours after treatment. When you consume caffeine or alcohol, you are dehydrating yourself, making it harder for your body to flush itself out. You need to drink 4 extra cups of water for every 1 caffeinated or alcoholic beverage you consume, on top of your total normal 8 cups or more a day on average. Avoid eating large meals 2 hours prior to and 1 hour after your treatment. Diet. Follow a low-carb, low-starch, low-sugar diet for best results. Try to do at least 20 minutes of high heart rate cardio workout after treatment. It is best to do it immediately after treatment and in the next 3 days after your treatment to stimulate lymph movement. No treatment on tummy, abdomen area 3 days prior to or during your menstrual cycle. So here's a list of what is typically used in no specific order. We have treatment table, the actual cavitation machine. You will need a conducting gel, sonogram gel, oil of your choice, towels, a towel warmer, a gel oil warmer, brush applicator, gloves, consent and also release forms, and measuring tape. And of course, you want to be sure that you are taking before and after pictures of your clients for their portfolio. Keep in mind that there are different machines on the market. Choose based on research and, of course, budget. Treatment time and settings per area will vary depending on clients. My advice is to limit treatment to 2 areas per visit to not overdo it and exhaust the body. Treatments usually last anywhere between 45 minutes to 60 minutes. Cost on average is from $150 to $350 per treatment, and of course, that's depending on location. During this demo, the treatment on the model will be done in the following order. Number 1, I prep the client by applying towels around the areas to be treated. Number 2, we are going to start off by doing cavitation for 15 to 20 minutes using conducting gel, which is ultrasound gel, doing horizontal movement, circular movements, and moving around the navel area as well. Once done, we are going to remove the product using a warm towel. We will then follow by applying oil of your choice. Make sure that it is nothing too thick. We are going to be using the vacuum radio frequency for 15 to 20 minutes. Be sure to set the release and the suction setting accordingly. Once done, remove the product with a warm towel. We are going to end the treatment by applying once again conducting gel to finish the treatment with radio frequency for 15 to 20 minutes, doing continuous circular movement to avoid burning the client. Once done, we are going to remove any leftover residue from the client's skin and give them aftercare instructions. And of course, do not forget to get an after picture of your client after the treatment, and it is best that you try to get the same or a similar angle from your before picture so that everything looks nice for your client's portfolio. All right, well, let's get started. Here is a quick view of what the machine that I will be using during this demo looks like and what the hand pieces look like as well. As you can see, this is the setting for the cavitation piece. This is what it looks like. We are going to be starting with cavitation. Also keep in mind that settings vary depending on clients. We are then going to follow it up with vacuum. Now again, for the vacuum, it is very important that you set up the settings accordingly. Every client will be different, but the dial that you are seeing me touch at the moment, that is the dial for the release. That is on the left side, and on the right side it is the suction release. And the one that I'm touching at the moment, it is the radio frequency. Then you can either time that accordingly depending on how long you want to do the treatment for, whether it's 15, 20, or 30 minutes. Again, it just depends. And I'm just simply showing you guys so that you can get a view from a different angle. And lastly, here are the settings for the body radio frequency, and that is what it looks like. Remember that it does get hot, so keep that in mind. Here's my measuring tape, treatment table. Here is a view of the conducting gel and my towel warmer. I have applied towels around the waistline of my model where I am going to be working around. I applied the conducting gel in a cup just for the purpose of applying it. I am using a brush. You guys can use a squeezing bottle. They do sell bottle warmers, okay, specifically for conducting gels and also oils. So if it's something that you are interested in, look further into purchasing one. And again, I'm starting with the cavitation. I'm briefly showing you guys in the direction that I will be moving. We will be doing a lot of circular movement and horizontal movement and going around the navel area. I'm not going to be doing much explaining. I just hope that the video speaks for itself and that you are watching my hand mobility and it gives you a better understanding. Alright, so now that we are done with our cavitation, here I am using a warm towel to remove the excess residue off of my client's abdomen. Next up, we are going to be using the vacuum, and here I am applying oil to be able to have the proper glide while doing this part of the treatment. You can clearly see and also hear why having the proper settings on the suction and release on the vacuum is very important. I move and glide my hands according to the release of the vacuum. So I ended the vacuum. I removed the leftover oil that was on the client's skin using again a warm towel. Now I am back again applying conducting gel to finish the treatment doing the radio frequency. Remember that during this part of the treatment, the radio frequency does get pretty warm and you have to continuously move the handpiece. I am doing a lot of circular movement and also horizontal movement, but I do not stop at any point, and this is to avoid accidentally burning the client, so be very careful. We are coming to the end of the treatment, so here I am removing any leftover conducting gel using a warm towel. Once we are done, be sure to always let your client know of any aftercare instructions, all the do's, all the don'ts. Make sure that you notate anything that is of concern of your clients. And that is it for this video. I hope you found it educational. If you did, don't forget to share, like, and please consider subscribing. As always, don't forget to keep going, keep growing, and I'll see you guys on the next one. Bye, guys.